can go ahead and start filming.
All right, ready.
Are you ready? All right. So today we're wanting to go over using continuous albuterol with Vaoptherm. Whenever you're using a Vaoptherm and continuous albuterol has been ordered, we have a Vaoptherm circuit setup that looks like this. It has aerosol written on it, so you'll know that you're grabbing the right one. I got this out of the 6th floor storage. This is what it looks like. We're used to seeing the regular cartridge that slides in. This one has a drain bottle. And this is where your Aerogen Solo is going to go in line. So I got the Aerogen Solo from the Aerogen supplies on the 6th floor. And like I said, the Vaoptherm circuit as well. I took out the white piece. That's how it came from the factory. Because if you're just going to use Vaoptherm and you're not going to be using the Aerogen, you have a plug there. But since we're using Aerogen, we'll put the Aerogen Solo in line. And then we can go ahead and put this in the Vaoptherm. You can see over here, we have our Vaoptherm. And we should be keeping a syringe pump on at least one Vaoptherm in the PICU. And we have our Aerogen charger ready to go. Battery pack ready to go. We plugged in our Aerogen for power, and we plugged in the syringe pump. We did not plug in the Vaoptherm right now because you all know how to set up the Vaoptherm. So we're not going to be turning the Vaoptherm on. We're just going to be turning on the syringe pump and then showing you how the albuterol goes in. Just like when we're typically setting up a Vaoptherm, locked down in there. You may think it can't close. You got to make sure that your Aerogen Solo is positioned correctly, and then you'd be able to close your door. You're going to need power for your Aerogen Solo. So from the Aerogen pack, plug in your power supply, and then you'll still be able to close the Vaoptherm door. So right now, we want to get the medication ready, and then we want to prepare the syringe pump.
So here you have what, Tim?
This is our concentrated 20 milliliters albuterol. And we want to remember that whenever we're using that with the Aerogen, we do not want to dilute. So we want to pour our 20 milliliters into our syringe. To do that, we used a 10 milliliter syringe and a needle. We pulled the medication out of the albuterol. We stuck it in the top of the hole, the cap, and then we put our 20 milliliters of albuterol in there. So we have 20 milliliters of albuterol ready to go. We attached our line, our Aerogen delivery tubing, and we're going to need to prime this line. Some nurses might do this by hand, but we're going to show you how you do it on the syringe pump. So now that you have your medication ready, let's take it over to the syringe pump. Your syringe pump, to start out, make sure that it's at least all closed up, ready to go. So power on. We've noticed that a couple syringe pumps have been configured differently. So if you're using one syringe pump compared to another syringe pump, you may be asked questions in a different order. If you get confused, feel free to ask your nurse, and she'll be able to navigate you to what it is that you're looking for, which is ultimately milliliters per hour. So let's pick PICU right here. This next part, we go straight to more because that doesn't pertain to us. We're looking for milliliters per hour. There's milliliters per hour. So just read what the syringe pump tells you to do and choose the number, 4. We know that this is a mono a mono type of syringe because there's the M on the syringe. So back to your syringe pump, you would choose mono. It's asking you now, and it's pointing you where you need to concentrate on putting in the syringe to the syringe pump. You have a top piece, you have this piece, and then you have the foot here. Raise this piece up, pulled that back. Your piece here needs to sit in and watch the line disappear when we do it. Into the bottom. The top piece comes around, the line went away. Lock this piece in by using these, grabbing the end of the pump, being careful, and then that arrow went away. So we have correctly put in the syringe into the syringe pump. Press enter. User ID, there's no specific user ID that these machines are looking for. So just pushing 1111 and enter, or any numbers that you choose, and pressing enter will get you to the next screen. The rate that we're looking for, that's all based upon what the doctor orders. We know that 5 milligram up to 20 milligram is what the doctor is going to order for continuous albuterol. And remember, that came from the concentrated albuterol bottles that we have whenever we give these patients the albuterol. There's 20 milliliters in here.
And there's 5 milligrams per ml. Yep.
And so is what we're going to do is the doctor, I'm going to push pause or silence, sorry. So if we know if the doctor ordered 5 milligram per hour, that would be 1 milliliter per hour that you would run the albuterol at. If it was 10 milligrams of albuterol that the doctor has ordered, you're going to run from the pump 2 milliliters per hour. 15 milligrams is 3 milliliters per hour, and 20 milligram for our most critical patients would get 4 milliliters per hour. So for the point of just giving a patient right now 20 milligrams, we know that that's going to be 4 milliliters. So I'm going to tell the machine that I want to deliver at a rate of 4 milliliters per hour. Enter. Enter bolus dose will be your next question. That doesn't pertain to us, so you just hit disable. Volume limit. This helps because the machine can alarm whenever we start to get down to a low amount of fluid to where we might need to come and then fill back up the syringe. So our volume limit, I put in 20 milliliters just a second ago. So our volume limit is going to be 20. Some nurses have told us that it might be smart to maybe put in a little less. That way the alarm would go off a little sooner. That way we're not being notified right whenever it's running out. But for right now, we'll just put in 20 milliliters because that's how much volume is in the syringe. Enter. Confirm settings. Volume limit 20, running at 4 milliliters per hour. Yes. Now we want to prime this line because if we were to give it to the patient right now, it would take a while for the medication to be able to get to the tip. So we're going to prime it with 3.65 milliliters. That's what the manufacturer says takes to prime this line. And so you'll see press and hold over to prime. Over's right there. So let's take it to 3.65. The medication is running through the tubing, and it's going to eventually ask you, are you sure you want to keep going? And when it does that, let off the button and keep going more. Remember, we're going all the way to 3.65. It may ask one more time, do we want to keep going? Yes, keep going. Push it again. 3.65. We had already had just a little bit of fluid in the line, so it's already starting to come out. But once you're at 3.65, Now you're ready to take your primed line and put that in your Aerogen Solo cup. The top pops off, your primed line, which isn't running yet, screws in nice and tight to where it's as close to the bottom as possible. Now you can still close the door. You can still close the door, making sure that all of your wires aren't being pinched. But now, come back on over, and we are done priming. So we can go to exit. Now press the start button to begin the infusion of 4 milliliters per hour. Start. We have our Aerogen to use continuous. You don't just push it once. You hold it for a few seconds. And of course, right now it's going to have an issue. Latasha, will you pull that other one over here for me real quick? There it is. Now we're in continuous mode. So you have to make sure that you hold it in for at least 3 to 5 seconds for it to switch over to continuous mode. Now the light switched from 30-minute treatment onto continuous. So you know that the Aerogen is actually working right now in continuous mode, and the drops will drop out. Any excess condensation that builds up in the chamber will drain out into your drain bottle, which if you need to empty, you will remember to click and then empty your bottle, making sure not to lose any pressures. You're not going to see drops too often, but there you can see where the drops just went through. And so it's going to give a drop faster the higher the milliliters that you're running. So right now we're running at 4 milliliters, and if I remember correctly, it's every 15 to 20 seconds roughly you're going to be getting a drop. If you were only running at 5 milligrams, which would be 1 milliliter per hour, you're going to be getting a drop a whole lot less. But remember, these are concentrated drops. They're not diluted. Any questions?
No, that was great. Thank you very much.
All right.
That was awesome.
Good luck. Any questions, feel free to call.
Thank you.